We are extraordinarily fortunate here in that we have a very strong Department of Psychology, and they provide a great deal of resource to us. But what we don't have is an equally strong Department of Psychiatry. We have one part-time psychiatrist, and there's far more need than just that one person. During the course of a year, we will admit a significant number of patients with complicated mental health histories who are on one or more psychiatric medications or mental health medications. Frequently they get admitted to our intensive care unit, and we're now faced with our intensivists, who are not psychiatrists, trying to figure out how to manage the medicine aspects or the medicine interactions of what are going on with those typically adolescents without the kind of support internally that they need.
Right now, when a patient in need of psychiatric care arrives in the Children's Medical Center of Dayton emergency room at night or during the weekend, emergency room physicians often have to call out-of-town child psychiatrists for help with decisions about treatment, a less than ideal situation.
I think not only here at Children's Medical Center, but I think across the country that there is an increased need for psychiatric, psychology, social work for children. We are at a point right now where the community mental health is overwhelmed, and it's very difficult to get folks connected to a resource within a reasonable amount of time.
The lack of adequate psychiatric services at Dayton Children's can also disrupt relationships between psychological therapists and patients.
I have a client that I was seeing. I diagnosed her with bipolar. Her parents would describe her as a very bad child, and she did have some problems, but she was also delightful.
The young patient had emotional problems that affected her life at school and at home. She needed a psychiatric evaluation, but the evaluation was not available at Dayton Children's. Eventually, she was sent elsewhere for continued psychiatric care, thus ending her psychological therapy at Dayton Children's.